One of the rules and regulations from CMS, and of course, subsequently all the other accreditors and most states probably, is that there is a clinician available 24/7. The rule actually is that your DPCS or designee need to be available at least by phone anytime. Hi everyone, my name is Mariam Treystman from the Home Health Consultant, and today we're going to be talking about call logs. But first, if you like our content, please like, share, and subscribe. So what are call logs? What are they used for? And who needs them? When we talk about call logs, we are referring to tracking if your agency is answering the phone at different hours of the day. So call logs are the logs of you checking if your phone is being answered appropriately. It's kind of like a secret shopper, but for your phone. So pretty much there are some accreditors. This is not really a Medicare requirement, but there are some accreditors, including ACHC, that want to see a call log from you. Possibly Joint Commission wants this as well, but ACHC definitely wants it. Either way, it's a good practice to maintain because home health and hospice agencies need to be available around the clock 24/7. Even though you might have office hours that are, let's say, 9 to 5 or whatever, your office hours may be, you still need to be available for patients if they call after office hours. This actually often includes calls from discharge planners from hospitals and things like that might be discharging patients after hours. So it's not, of course, we still need to do it for patients. This is a requirement, but there's also some self-interest in there because outside of like patients needing help, you could be receiving referrals at that time. So it's definitely a good idea, both because it's the law and because it's good for your patients, and also because you could be receiving referrals during that time. What call logs do is pretty much it's a log of you attempting to call the agency phone at different times. So typically what happens is from your office, during your office hours, the people who work at the office will be answering the phone. You generally expect most, if not all, calls to be answered, assuming that your staff is there and, the phone lines aren't all busy and things like that. So for the most part, you expect phone calls to be answered during your office hours. After office hours, there is usually somebody on call. One of the rules and regulations from CMS, and of course, subsequently all the other accreditors and most states probably, is that there is a clinician available 24/7. The rule actually is that your DPCS or designee need to be available at least by phone anytime. And so if you have somebody on call, the person who's on call, aka the person who is answering the call after hours, does not need to be the clinician, but they need to be able to reach the clinician, whoever is the clinician on call, if needed. So agencies approach this in a variety of ways. Sometimes this is transferred to an office member's cell phone. For example, 1 million years ago when I worked in a home health agency, I had an on-call shift. I'm not a clinician. I would just answer whatever phone calls will come in, and then I would connect to our DPCS and have them connect with patients or whoever needed to speak with them when appropriate. Because a lot of times the after hours calls are like sales calls, wrong numbers, I don't know, whatever, things like that. So it doesn't require your like top management staff to answer all those calls. So one way is just to like assign a staff member to be on call after hours. Another way that I've seen people do this is they will have an on-call kind of like company. There's companies that will be like phone call services that will be kind of intercepting every call that comes in. The call comes in, they take a message. and then they direct that message to the appropriate person or to the, an email or however it is that you've designated them to like communicate with you. What you're doing with the on-call logs is you are calling your phone line at random times during office hours and outside of office hours to make sure that the phone is being answered promptly. If it's not being answered, you're checking to see how many times you need to call for the answer to come, or how many minutes after the missed call you are getting a call back. It's a good idea if you're doing these call checks, like let's say you're the owner or the administrator that's going to be doing these call checks or whatever, not to call from your cell phone or a number that is logged as an important number in whatever the system is that is doing the after hours, picking up the after hours phone calls. So like, for example, if I own the agency, I don't want to check it from my cell phone because they're going to see it's me and they're definitely going to answer. You want to call from random phone numbers or a random phone number that's not automatically associated with you. And so people will not like jump to answer it necessarily just because it's you. And so essentially you're just calling. Let's say once a week, you call once during the daytime, once during the evening, or once during the daytime, once during early morning. You want to mix it up. If you're doing these calls, you don't want to call every time at like 7 p.m. One time you can call at 7 p.m. One time you can call at 9 p.m. One time call at midnight. One time call at 6 a.m. There is no required frequency to how often you need to do these checks. If you don't have resources or time or whatever, you could do this monthly, for example. One time in the month, you could do it during office hours, one time after office hours. A really good frequency is once a week. That's just really going to make sure that no matter how your call structure changes, especially for the after office hours, that you are checking on it and that you're just consistent with it. Either way, as you do these calls, the number of calls you do during and after office hours need to be kind of pre-designated. There's no like rule, there's not big rules around it. They just want to see that you're checking pretty much. But you want to say, for example, I'm going to do this once a week, or I'm going to do this once a month, or, whatever. The important thing is that it's not public knowledge when you're going to do it, so that the people who are like supposed to be answering the call are not aware and ready for your call. And essentially, when you do these calls, you keep a log. That is the call log we are referring to. And so, for example, in this log, you put in there the office hours. So let's say 9 to 5. And then the remainder 5 to 9, right? So 9 a.m. to 5 p.m. and then 5 p.m. to 9 a.m. And you can kind of like structure it. We'll have an attachment in the article, in the corresponding article. But pretty much you can structure it where this is this shift, this is this shift. I called on this date. They answered on the first. It doesn't matter how many rings go by. You don't have to be like on the first ring or whatever. If you want to have metrics or track that or be like, there's some companies we have to answer by the second ring or, whatever. If that's what you're doing, good for you. And you could do that, but that's not necessary for this. But you should know, did it take you one call, 2 calls? Did they answer on the call? Did they call you back? If they called you back, how many minutes did it take them to call you back? And things like that. These are the things that you were actually logging. You also need to include in that who was responsible for the on-call answering in that moment. And then, of course, if you see some kind of patterned non-responsiveness or whatever, then you address it via whatever, you could just have a conversation, or you could do even a PIP, a performance improvement project, whatever it is that you feel is necessary and relevant for your company. Or maybe you switch out the person or the phone system that's doing the interception of the call. So that's pretty much a call log. This is checked at survey with ACHC and possibly other accreditors. So I really highly recommend you guys do this. Please set a frequency. When you do set a frequency, include that frequency in your policies, because as we've said in previous videos, specifically the continuity video, when you don't do something you're supposed to do, now we're checking the policy to see if you were following the policy. Now you're getting 2 deficiencies, the whole thing. So please make sure you're doing your call logs, checking to see if your phone is being answered during and after office hours. When you are checking this, please call it random times within the shift so that people don't expect it. The days that you're going to be checking it, please do not announce it to anybody so that people aren't specifically ready for you to call, and so they are specifically on guard for it. When you are calling, don't call from your cell phone if you are a management position or, whatever, so that people feel like this is a random phone number that's calling, and they will treat it as if it's a random patient or a random whatever call that's coming in. And of course, definitely document and log this. So that is call logs. My name is Mariam Treystman from the Home Health Consultant. And if you like our content, please like, share, and subscribe. Thank you.